One of my most difficult days here at Wave 3 News was just under 2 weeks ago. I told the story of how our city's out-of-control gun violence claimed the life of a 16-year-old woman named Tiffany Floyd. She had an incredibly bright future ahead of her. As a talented basketball player, she was loved by her family and her teammates. And instead of realizing her great potential, she was gunned down on her grandfather's doorstep. Tiffany Floyd was the 60th homicide victim in Louisville this year. And here we are 13 days later, and already 8 more people have died. As of 9:30 this morning, 68 homicides in Louisville. That's 68 lives that have been lost. 263 people have suffered non-fatal shooting injuries. That's people who now have physical and emotional injuries for life. We have gone through 16 straight months, that's February 2020 through May of 2021, of double-digit homicides. Double digits. 841 non-fatal shootings from February 2020 to May of this year. Bed space. The problem is so bad now that bed space for non-fatal shooting patients has had to double since January 2020. Here to talk more about what this violence is doing to us and to our city is Christopher Tuex, Executive Director of Christopher Tuex Game Changers. I'd also like to welcome UofL Trauma Surgeon Dr. Keith Miller and UofL Transplant Surgeon Dr. Christopher Jones. Thank you all for being here.
Thank
Chris,
you.
The first question I have for you, I always describe this gun violence as out of control in our city. Is that an exaggeration?
No, David, it's not. And unfortunately, the numbers that you just displayed speaks to that. It's strong evidence, and nobody can turn an eye away from the truth. It's factual.
I got a little emotional talking about this just leading into you. I mean, Dr. Miller, how do you do this every day when you see these people broken and bleeding at your workplace coming to you for help every day?
Yeah, that's a question we always struggle with because we don't really, I don't think it's fair to talk about how we deal with that. We volunteer to be there every day. We choose to be there. That's what we have decided to do with our lives. We're passionate about it, but our patients do not choose to be there. And the focus remains on them. The focus remains on their families. And so, you know, there is an element of secondary trauma as a healthcare provider, and we understand that, acknowledge it. We try to provide some support infrastructure within the hospital in order to deal with that. But the attention, the focus has to stay on the patients and the families, not on the healthcare providers in this situation.
The doctors can put their bodies back together, but Chris, you have to work with the families. There is trauma that goes far beyond just the person who was shot.
There's no doubt about that, David. And, you know, I've been describing for a while, and especially putting a lot of emphasis on it lately, the collateral damage, David. And you just talked about the 16-year-old. But there's so many young individuals, even younger than her, who never get hit by a bullet, but they're impacted by the collateral damage as it relates to this reckless gunplay, and it traumatizes the kids in many ways, and they react in many ways. And unfortunately, some start to
act out
and start to get these kind of anger issues that leads down a pathway for them to be sucked into the vacuum of the reckless gunplay life, to be quite frank with you.
And we're coming up on the summer months, and typically the summer is when we see the most violence. And where we are right now, this does not bode well for us. Absolutely
not. And when you look at it, David, as a continuum from 20, with these numbers, the trajectory is bad. I mean, and I'm not into the blame game conversations, but at the end of the day, the force that's really fueling this situation is none that we've seen before, to be quite frank with you, in previous years before 2020.
What's different about this? And we've had conversations before where we talk about how the shooters now are different than they used to be. They have no rules, they have no remorse, but the factors behind them are also changing, aren't they?
Yeah, because of the attractiveness of the issue. And when I say that, David, I'm saying attractiveness in an ugly way. And then when you look at the pain associated with every gunshot situation, whether fatal or non-fatal, it invokes into the mind of a mindset of revenge, and then one shooting leads to the next and the next and the next, whether it happened 2 or 3 years ago or yesterday.
There are so many different causes behind what we're seeing. There's going to have to be any number of solutions to address each of those factors. But Dr. Jones, tell me about this, something that you're involved in, both of you are involved in, the Future Healers program. How does that work?
Sure. So this is a wonderful program that was actually born out of some of the protests that began. As you know, this is the year date of the George Floyd murder. And a lot of this was kind of born out of what we were seeing in our city, as well as what was going on around the country. And it's a group of medical students that just wanted to come together to make a difference. These students, a lot of them are from our community. They have experienced some of the things that we're talking about here today. And as they move forward, they want to reach back into the community to help someone else so that things can be more positive. Our kids can have a more positive outlook as they move forward.
Dr. Miller, how important is this sort of effort right now, getting more people involved with more shared experience in this?
Absolutely. I think you alluded to the multiple contributing factors here. I mean, this is a public health approach, which is what's required in this situation. I think we all readily accepted the notion that COVID required a public health response. Gun violence has not been historically approached that way, but I think there's now momentum, at least in our community, where we're starting to address these multiple factors. You've got individual, group, community, and societal factors, and you can start on either end or you can start in the middle, and that's what I think Future Healers program is sort of designed to do.
Now, Chris, in the work that you're doing with Game Changers, you're trying to interrupt this cycle of violence. How long does that take? A child grows up with this for several years in their neighborhood and in their area, and they're dealing with it. How long does it take to get past that?
Well, David, to be quite frank with you, if there's no early intervention and you see these symptoms going on at the early childhood development ages and elementary school and all that, then you know it grows and grows and grows. And then it explodes at 12, 13, 14 years old, where unfortunately, David, in the time frame we're in right now, it's hard to turn it back. So there's got to be early intervention right now and hard conversation even in the early childhood development years and elementary school years.
What kind of success stories have you seen so far?
Well, as far as Future Healers, I think the success story in itself is the photo that you all just put up. How often do we see black kids in scrubs with stethoscopes? That's a hopeful sign. That's a hopeful image. And I think Dr. Jones and Dr. Miller, the students at U of L who are part of this at the School of Medicine, feel just gratified that we're starting the progress of moving this forward on a step-by-step basis to get the kids interested in the medical arena. And that's very important, that they see something else besides some of the things they see as on the ugly side. And this is a total positive side on how can we look at the ugly but come back and be healers to make people feel good.
Dr. Jones, Dr. Miller, you're both dealing with this inside the hospital. What needs to happen out in the community right now to assist the efforts that you're putting out there?
Well, I think one of the things that has to occur is getting the word out. We need to be more involved in the community from the medical side so that people know that, you know, we're not just behind our four walls doing what we do inside of the hospital, but we are actually a part of the community in which we live. And once we can do that, I think people will join in with us in terms of helping to curb some of this violence that we're seeing out in the community.
Dr. Miller, what would you like to see people do?
David, I just appreciate, continuing to bring attention to this issue. What our community, our city is experiencing now is not acceptable. It's not okay. This is not a hopeless situation. There are solutions to this issue. We just have to commit and sustain to approaches that can successfully address the issue. And that's, that's the biggest thing I would pass along, I think.
I'm glad to hear you say that it's not hopeless. Chris, what signs of hope have you seen in the last few months that tell you that maybe we can get a hold of this?
People are starting to recognize what Dr. Jones and Dr. Miller and those in the healthcare arena already understand. It's a public health crisis. We've got to think of it from that aspect. And to be quite frank with you, David, if we know children are getting affected by and impacted by the issue, there's no way around it. We have to actually respond to the trauma that they're being impacted by. And violence is ugly, David, but at the end of the day, a lot of things are ugly in life, but good people rise for the occasion to do the right thing to make things better.
And I feel like we are all being affected by this ugliness in one way or another. Our city is losing so much talent with these lives that are lost.
There's no
cannot
doubt
make
about
up for
that. David, there's no doubt about that. And I tell you what, Dr. Miller and Dr. Jones, they understand the gravity of what's been going on in the hospital. And I can tell you at the end of the day, what the hope is for us with this Future Healers program, it's not a save-all, but at the end of the day, we know a lot of the people who look at that photo or that photo that we've been putting out there of those kids and that wonderful trauma facility dog, Rue. We know that people in that arena, especially those African Americans in the medical arena, can now look now and say, look, we're proud of what we do, and we've got to be having frank conversations about these kids on how we deal with the damage that's being caused and not shy away from it.
As a journalist, it's probably one of the biggest challenges of my career. This is such a big problem, and it's happening right where I live. I can't talk about this enough, and gentlemen, thank you so much for all the work that you're doing. Well, we've got to get a hold of this.
Yep.
We've got to turn this around.
Totally agree, David.
Absolutely.
All right. Well, thank you very much for being here.
Thank you.
Thank you, Dave.